like Adrian said, I'm Patricia Marik, and I'm a pediatric psychologist at Children's. And today, I want to talk a little bit about how to help your children adjust. And actually, what you'll see throughout a lot of this is there's not necessarily a lot that's specific for youth with facial differences. Kind of the general common sense things are really what works for everybody. So I also want to talk a little bit about how all of our self-concepts develop. That was a question that was posed to me a couple of times. So just kind of how do we figure out who we are and how we're the same and how we're different, and what can you all as parents and grandparents and aunts and uncles and whoever else is here really support that. A little bit today, I'm going to talk, like I said, developmental self-concept, how you can help foster that healthy self-concept. A little bit about coping, both how to build resiliency to avoid coping difficulties, and then how do you address concerns if they have already developed. What are some warning signs that your children may be struggling a little bit more than they would expect, and then what can you do about that? So kind of the Psych 101 portion of the day. A little bit about how we all develop. Anybody who, like I said, took Psych 101 probably studied Erik Erikson. And I'm not going to go over these too much, but this is just important to consider as you look at children at different ages, what's going on within them so that they can develop psychosocially. The first stage is kind of that birth to 1 year of age, and the big task in that phase is developing trust. These are, babies don't need a lot except for love and attention and predictability. If you can do those things, you're going to be pretty good, and your baby's going to learn to trust you, trust the world. At this point, they don't know if they're the same as others or if they're different. Really, they just care about having their needs met. Where this comes into play, and Jenny's going to talk about this a little bit as well, is if parents are struggling, if you're struggling to deal with this diagnosis, or if you're feeling extra stressed, you may not be as available to help your baby, which could lead to some difficulties. The next phase is that autonomy versus shame or doubt. Those are the toddlers that are trying to do everything by themselves. For better or for worse, they're trying to feed themselves, they're trying to, they kind of run away but then peek back over the shoulder to make sure mom and dad are still there. And then they run a little bit farther, and then they look back. Really, in this phase, you really want to make sure that you're allowing your children to explore. As much as you may want to keep your kids in a bubble, especially if they've been through a lot medically, that's not what's going to be best for them long term. You really need to let them get out, let them explore, let them fall down a little bit, be there to pick them back up again, but allow them and really reinforce that attempt at exerting their independence. The next phase, that kind of 3 to 6 years of initiative versus guilt, is kind of the same thing, really. They're trying things. You really want to reinforce their efforts. You want to reinforce if they're out there trying to make friends. You want to reinforce if they're trying to, get themselves dressed, even if the clothes don't match, or if they're trying to feed themselves, even if it's head to toe they're a mess. You really want to reinforce that. At kind of the school age, the 6 years to kind of puberty is once again where they're really starting to have awareness of themselves as an individual. They're starting to really develop their self-concept, their self-confidence, really not until kind of 5 or 6. So this is the phase where you really want to reinforce when they're trying. You want to reinforce if they're making appropriate choices. We see in this phase, if kids are trying to maybe separate themselves from their parents a little bit, they may be disobedient, they may be defiant. Where this may come into play is if there's other kids on the playground who are maybe teasing or asking questions. Not saying it's okay, but this may be that they're struggling with their own identity and really maybe working with their parents. I'm going to talk about that a little bit, but working with their parents to help their parents parent that child a little bit better so that they're not lashing out at other kids. Adolescence is that identity. Who am I? How do I fit into the world? One day my hair is pink, the next day it's purple, and really just reinforcing and trying out different things as long as it's safe. And then the last phase I'm going to talk about very briefly is just that intimacy versus isolation in young adulthood. It's the who am I away from my family, having social relationships, having romantic relationships, really being a social being. You can see a lot of these had social aspects to them. A lot of these depend on trying things out, really seeing who you are in relation to other people. So what is self-concept? Before we start to talk about how it develops, I think it's important that we're all on the same page about what it is. And the going definition right now is that self-concept is the image or concept that people have of themselves and their abilities, be they physical, mental, or social, and then the value, either positive or negative, that they place on those self-evaluations. So you can see it's not just appearance. Our self-concept is based on a whole lot more than how we look or what we do. It can be how smart we are, it can be how artistic we are, it can be how great of a jumper or a runner or how good of a big brother I am. It can be any of those things. And then the other important thing to point out is also the value that you place on it. So everything in life is neutral until we assign a value to it. So a question about your appearance, until you kind of figure out is it a good question or a bad question, kids aren't going to make that value judgment until we as adults make that judgment. So really making sure that from birth, you're reinforcing with your kids the things that they're trying. You're reinforcing not just how they look, but what they do. That they're a really great color, or they're a really great musician, or whatever it is, and really making sure that you're placing a lot of positive value on that. We talk a lot about that. You can't have a self-concept until you're cognitively developed enough to know who you are. Kids are very self-centered. Babies, like I said, they just care about getting their needs met. Toddlers, it's all about them. You have to be able to realize that there's other people in the world before you can figure out how they're looking at you. So in infancy, that brain is still developing. We come into the world predisposed for these social exchanges, but we need the social interactions to develop that. So if you keep your kids in that bubble, if you don't take them to church, don't take them out, don't take them to the playground, their social skills aren't going to develop quite as well. Well, that's hardwired in us. We need to have those interactions in order for it to really develop. Infants are also developing their emotional regulation, which is, I scream until somebody comes and helps me. I scream because I'm hungry, and then somebody comes and feeds me, and I feel better, so I stop screaming. Once again, it's also through interactions. It's looking like babies probably begin to differentiate among people at that kind of 6 to 12 months. Before that, as long as somebody's being nice to them, talking to them in a nice voice, giving them food, it can be anybody. And then those of you with babies see when you hit that kind of 6, 7, 8 months, they start to cry when you drop them off at daycare or things like that. And I think another important study, and it's a pretty old study, you can see it's from 1959, but is that the impact of hospitalization or separation from family becomes salient at about 7 months of age. Now, the reason I point out this is an older study is, in 1959, I'm guessing people, parents weren't encouraged to stay at the hospital with their kids, and it was kind of, you dropped them off, you went for visiting hours. Now, you have a bed right in your hospital room, and you're there the whole time. But what they found was that at 7 months of age is when children or babies became very distressed by being separated from their parents for medical procedures. So that is important to consider when you're making decisions about different medical treatments, is how much is this going to cause me to be separated from my child? I know a lot of parents, a lot of families, and 2-parent families, one parent stays at home with the other kids, the other parent goes to the hospital. So what impact is that separation going to have on the relationship with the other parent? Not saying you can't overcome that, but they're just things to consider when you're making some decisions about treatments. Toddlers, they're becoming more social with others. Social interaction usually involves objects and activities. You might see that parallel play of they're on the ground playing next to each other, but they're really not interacting. This is when social referencing begins. And I want to talk about social referencing just for a minute because I think it's really important in this setting. It's when somebody walks into the room or somebody asks a question and your toddler kind of looks at you. They look to see how you respond. And they don't just look to see or to hear the words you're going to use, but they look to see how you respond verbally and non-verbally. So if somebody comes up on the playground and asks a pretty neutral question, they're going to kind of look to you, and if you get mad, if you get defensive, if you get embarrassed, if you just kind of physically and verbally just kind of answer the question appropriately, that's how they're going to start to learn how to respond to the questions when they get them. So if they only see you get really mad every time you're asked a question, they're probably going to get mad when they're asked a question. If they see you get kind of embarrassed, they're going to get embarrassed. If they see you just kind of, yeah, I'm going to answer this question, I'm going to say it's a birthmark, or I'm going to say, what questions do you have? They're going to learn that that's how you respond to these questions. We see this social pretend play emerge. Still, there's just the start of social interaction. There's not a lot of kids asking questions, looking at each other, even having an awareness that they're different from each other. Really the main emotions that kids are having when they're toddlers are what we call our fundamental emotions, or joy, anger, surprise, and fear. None of those are really self-conscious. You'll see I talk about that at kind of 3 to 4 years of age is when you start to develop your self-conscious emotions, so that's embarrassment. So up until that point, kids aren't really truly having those self-conscious emotions. As adults, we may be, but they're not. You start to have good friends around the age of 3. You might see those of you who have kind of 3-year-olds, they start to ask you, is that your friend? Mommy, is that your friend? Because they're starting to have their own friends. Or, you know, that's mommy's friend, or that's daddy's friend, or are you going to see your friends today? Because they're starting to realize that friends are different than playmates. And they're starting to make the connections that friends are people who I like, who are nice to me, and playmates are maybe those people who maybe ask me questions that I don't want to answer, or say things that I don't like. And they're starting to make that differentiation. Kind of 4 on is when we start to see those true peer relationships emerge. The social interaction becomes a lot more formal. You might see your children still playing alone, and that's appropriate. Just because your child's off at daycare playing in the corner by themselves, not necessarily anything that you need to worry about. How that is different is we talk about kids who are being alone. Those are the kids who want to play, and they kind of hover along the border there of the friendships, but they can't engage for whatever reason. And that is something we might worry about a little bit more. But kids who, sometimes just want to take their Barbies and play in the corner, not a big deal at all, pretty appropriate developmentally. We start to talk about self-esteem really not until about 4 years of age. I think it's really important to point out that most kids see themselves as really good and likable. I'm the best jumper. Look at me, look at how high I can jump. They're jumping this high off the ground. But in their minds, they're the best at it. And this is how most kids are naturally. So really reinforcing that, yeah, you're an awesome jumper, you're jumping really high, is going to make them feel really good. You kind of see how good they feel when they bring you a picture that you drew, and you're looking at it trying to figure out what it is, and they're really proud of that. Another thing I think is really important to point out, and really gives me a lot of hope about kids, is they will even shift their reality to fit this positive self-evaluation. I have a great story for this. I have a nephew who's about this age, and he thinks he's the best baseball player. He thinks he's just, he can run faster than anybody, he can hit better than anybody. And we were out playing, and he wanted me to pitch to him, so I'm pitching to him, and I was trying to get him so he could hit it. I was doing my best so that he could hit it without a problem, and he kept missing, and he kept saying, I'm the best, I'm the best. And then finally he looked at me and he said, yeah, Tricia, you're not a very good pitcher. So we shifted the reality to, it wasn't that he couldn't hit, it was that I couldn't pitch. So, he did that to maintain his good self-esteem, and I said, you're right, I'm not. And he could have taken that and said, oh, I'm a horrible baseball player, but at this age, he's not going to. As long as I responded with, yep, Stephen, you're right, I'm not a very good pitcher, that helped him maintain his self-image and his good self-concept. We also see that social competence starts to develop about the age of 4. So we want our kids to be able to engage well, we want them to be able to take the lead, but we also want them to be able to follow. Nobody likes somebody who always has to be in charge. And so you want to reinforce your kids being leaders, whether it's on the playground, or with cousins, or at daycare, but also sometimes letting other kids lead. I think sometimes we want to reinforce so much, our kids being outgoing and being leaders, that we forget to also reinforce when they follow other kids and let other kids lead. So we really want to reinforce both. Just a kind of summary, we know that really there's no true self-awareness until about 20 months of age. This is an interesting study. They took a bunch of babies of all different ages and put a little bit of blush on their nose and put them in front of a mirror. And up until an average of 20 months of age, the babies would reach at the mirror and kind of try and rub the blush off the nose on the person in the mirror. And then at an average of 20 months of age, they started to realize, wait, that's me in that mirror. So up until that point, they didn't even realize that person in the mirror was them. You might see that when babies kind of talk to mirrors, like they think they're talking to a friend, kind of badly to a friend, when really it's them there. Those self-conscious emotions develop around 3, and we don't talk about self-esteem really until about 4 years of age. And one of the big messages I want you all to take home is that you need exposure. You need exposure to positive social interactions, and you also need exposure to some negative social interactions to really develop who you are as a person. I'm just going to touch real briefly on this, because I know this is a question that I was asked, is what things should we go into medical decision making? I'm going to kind of dance around it a little bit and go to that medical input and say, I always defer to my physician colleagues. If this is a surgery, if this is a procedure that has to happen, it has to happen. But if it's maybe, there's a question about does this need to happen right now, can it happen in a little while, we look at things like prior and future medical interventions. How many surgeries, how many hospitalizations, how many procedures are your children having, and at what point? What's their experience? Are these kids who don't really mind the hospital, they kind of roll with it, or is this a child who gets very, very anxious? If your child's a little bit older and is in any sort of therapy, talk to the therapist and find out. And then parental and family functioning. Jenny's going to talk about that a little bit more, but you know, how's the family doing? What are the reasons we're making some of these decisions that we're making? So how do you have a kid with good self-confidence? I'm guessing you can probably all do it. There's no secret to it. It's actually, you have to work a little bit harder to have a kid with really poor self-concept. If you do a lot of kind of these common sense things, your kids are probably going to be okay. You want to really focus on their positive attributes. What can they do really well? Like I said, are they a good sharer? Are they good at helping you with the dishes? Are they, you know, really funny or friendly or outgoing? Or, you know, are they good at playing by themselves or good at reading? What are they good at? You want to be generous with your praise, and you really want to label what you're praising. Kids don't always make the connections. You know, if they help clear the dinner table and then, you know, you say, hey, good job, they might not make the connection of, oh, that's because I did this. So really labeling, awesome job helping me clear the dinner table, or, you know, I really like how you're, you know, playing with your little brother. Model positive self-statements about yourself. This is hard for all of us, myself included. Sometimes, you know, you look in the mirror or you're talking about your day, and, oh, you know, I really messed up that presentation, or, oh, you know, I really screwed up that meeting with my boss, or whatever it is. Your kids are listening to that. And you all know that your kids want to be just like you. You know, they put on your jewelry, they put on your high heels, they're looking in the mirror. They're going to copy what you're saying too. So really making sure that you're not saying bad things about yourself in front of them, and actually you're saying good things about yourself. You're modeling that they can make positive self-statements. It's okay to talk about what we're really good at or what makes us special. You want to avoid criticism in the form of ridicule or shame. So, you know, the classic, and I know it's easier to say than do in the moment, but the classic, you made a bad choice as opposed to you're a bad kid, is really going to help them have that healthy self-concept. Model problem solving and recognizing good decisions. There's not always an easy answer to everything, but really sitting down with your child, especially when they're a little bit older, and talking them through, okay, what are we going to do about this problem? You failed your chemistry test. What are we going to do about it? When they do make good choices, when they're much older than a lot of the children in this room, you know, if they call you from the party and when they're 13 and they say, there's people here making decisions I'm not okay with, reinforce them for calling you. Yeah, maybe you deal with the fact that they were at the party and they weren't supposed to be there, but reinforce that they made that good choice of calling you. Discipline appropriately. Now this is one we get a lot in terms of kind of the sick child role. And it's, you might see parents, you might see grandparents, you might see other people who, oh, you know, they've been through so much. You know, they can run wild around the house. They've been, you know, they just got out of the hospital. I'm not going to make them go to bed, or I'm going to let them watch extra TV. Extra hugs, extra kisses, you bet. But really still having the same behavioral expectations that you would have for any other child. That's going to help them feel like, I'm okay. I have this really healthy self-concept, and mom and dad or grandma or grandpa, whoever, are going to kind of keep me in line if I start to kind of stray from that a little bit. You really want to model and teach assertiveness as opposed to aggressiveness or passivity. We don't want our kids to just kind of be made fun of and just kind of sit there. We also don't want them to be made fun of and touch somebody. So it's that middle ground of asserting yourself, of saying, hey, do you have questions? Or, you know, I see you looking at my child. Would you like to meet them? That was discussed yesterday. This is another that's kind of hard. Try not to blame your children for how you feel. You know, we all say you're making me mad, or, you know, you're making me stressed out by your choices, or whatever it is. But you really want to make sure that you reinforce that each of us are responsible for how we feel. So really kind of owning your feelings that you're having a bad day is going to help them understand, yeah, I can do something about how I'm feeling myself. Little bit about self-concept in youth with facial differences, and the caveat here is that there's no research really in terms of PHACE syndrome and self-concept that we could find. So this is looking more at just general craniofacial differences, and this is kind of more adolescence and beyond. We know that youth with facial differences might be a bit more socially inhibited, so they may not be the class clown, they might be a little bit more quiet, a little bit more withdrawn. They might be more likely to internalize. We talk about internalizing and externalizing. Externalizers are the kids who are yelling, punching, screaming, running around the classroom, the ones that are probably being noticed by the teachers. And the internalizers are kind of more, I'm depressed, I'm anxious, I'm going to kind of keep things in. Just because they're quiet, not getting into trouble, doesn't mean they're not struggling emotionally, but they're more likely to kind of keep it in. One of my favorite statistics is that children with some craniofacial differences may actually have normal, if not better, self-concept than their peers. This is actually the kind of the hypothesis behind this is because in youth with facial differences, we're all so aware of it, and we are really emphasizing all the things that they're really good at. We're reinforcing their healthy self-concept. We're very aware if there is any teasing or bullying going on, that we may actually help them have a better self-concept than children who we kind of take it for granted, kids who don't have facial differences. So, how do you prevent the difficulties? I talked about resiliency a little bit. You want to pay attention to how you handle social situations from birth. I don't have a magic answer for every question that you might get, but having that kind of neutral response, not necessarily just ignoring things, but really, I think there were a lot of great things brought up yesterday. You know, do you have questions? Do you want to meet my child? Really paying attention to how you handle those social situations, because they're going to look to you. Your kids are going to look to you to how do I interact? How do I handle questions I might get? You want to encourage those healthy and positive social interactions from birth. You know, like I said, anything that you would do, surgeries or whatever it is, you're remembering every minute of it. You're living every minute of it. They're not going to remember that, especially the real little ones, but it is a big part of who they are. So keeping maybe a scrapbook of all of their, hospital bracelets or pictures or different things like that, they may want to look at that someday. When they're in that identity phase of development, they may want to look at that and see, what's my history? So it can be really, really helpful to have. They may never want to look at it, and that's fine too, but you kind of can't go back and recreate it, so keep a scrapbook or keep a photo album. You also want to just make sure you're labeling and providing information. The worst thing that happens for any of us is we get asked a question about ourselves that we don't know the answer to. So having appropriate information, age-appropriate information, saying it's a birthmark, or whatever your family's going to say, but talking about it is going to be really important. Role-playing, especially before transitions with a little bit older kids before they go to school. Role-play, what if you get questions about why did you have to go to the doctor today? Or what if you get questions about different things? How are you going to answer it? Kids love to pretend to be the adults, so let your child be the teacher, and two adults can be the two kids, and they're going to love that. It's going to be play for them, it's going to be fun. A really important one that there's some research that shows that this is really helpful is just having a family structure and a family environment where you talk about your day. Ideally, it'd be over the dinner table, before bed every day. I know with a lot of families with sports and things that's not possible. But just starting from when kids are very young, just to talk about your day. What went well, what didn't go well. Parents do it too. What that does is it just creates an environment where you talk. Your children are much more likely to bring up if they're being teased, if they're getting questions they can't answer, if there's already an environment where you do that, versus them having to say, okay, I want to talk to mom about this, when should I find her, how do I bring it up? But if there's already that set time that when we talk about our day, the Blackberries are away, iPhones are away, everything's put away, and we're just talking, they're going to be much more likely to bring up any difficulties they are having. You want to pay attention to your response to concerns, especially with maybe kind of school-age kids. If you hear your child's being teased, your first instinct is, I'm going to go to school, I'm going to yell at the kid who's teasing them, I'm going to talk to the teacher. If you think about when you're a kid, that having your parent come to the school may actually be the worst possible thing that you can do. So just pay attention to your response. You want to communicate with adults and teachers who observe your children in a little bit less structured settings. Not just a classroom teacher. Kids probably aren't going to be teased a whole lot in the classroom, but the bus driver or the recess monitor. Those less structured times are the times when there might be more questions asked or more teasing that might be happening. Remember that everybody's teased at some point in their life. I'm fairly certain everybody in this room at some point in their life was teased. So being teased doesn't necessarily mean you're being set up for a life of difficulties. It's how you deal with it. We know that the impact is worsened a lot by just not knowing what to do with it. So not having an answer, not having somebody to talk to. We know that positive social skills not only can decrease the impact of any bullying or teasing that is going on, but it can actually decrease the incidence of bullying or teasing in general. You know, nobody wants to go up and play on the playground with a kid that has their head down and isn't looking at anybody. But if you have good social skills, if you can look at people, you're probably not going to get teased as much. Anyway, you want to help them explore the comments that they may have perceived as teasing. It may have been just a question. Who said it? Why did they say it? This is develop a plan with your child, not I'm just going to go to the school and yell at everybody in sight. But really, what does your child want you to do? Doesn't mean you're not going to do something else, but talking them through it, what do you want me to do? Teaching them to take charge of a conversation. There's some good research out there that shows that, well, I know myself included, we tell kids, oh, just ignore it if you're being teased. And that doesn't actually decrease the risk of being teased. It doesn't decrease the intensity of the teasing. So teaching your kids, you respond neutrally. You kind of give the information, well, this is how I was born, or it's a birthmark, or whatever you're going to say, and then you maybe change the topic. So you take charge of the conversation. This is that teaching our kids to have really good social skills. It's really going to help them with teasing. Briefly, just some signs that your child may be experiencing more difficulty coping or maybe experiencing some behavioral and mood difficulties. Change in personality, lasting changes in mood, especially as kids get older. They're going to have the good days, they're going to have the bad days. If there's a pretty significant lasting change in mood over a couple of weeks. If they start avoiding things, if they don't want to go to the playground anymore, if they don't want to go to school, if they suddenly have a stomachache every day before school, if you hear a lot of the repeated or habitual negative self-statements. Once again, we all do it, but if you hear a lot of it over and over again. So what do you do about that? Usually what we say is if you have concerns about your child's emotional functioning, you can get a referral from your pediatrician, from a physician, from a school counselor, social worker, even from your insurance company. We all know the mental health world is very difficult to navigate. You're probably going to be sent either to a psychologist, kind of a psychotherapist, a counselor, or a psychiatrist. I kind of listed out some of the training there. Different states have different laws about who can and can't do psychotherapy, but it's probably going to be one of those three. You want to make sure, if possible, you really meet with a professional who has experience working with kids. Ideally, somebody who has experience working with kids who have health conditions. If you're not in a major city, that might be a little more of a challenge. Every children's hospital has psychologists that do have that experience, but at least a professional who has experience working with kids is going to be important. There'll probably be an evaluation at first, and then there might be recommendations made for your home. If your presenting concern is that your child is having a lot of behavioral difficulties, and through that evaluation, it kind of comes out that you have fallen into that kind of stick child role of not expecting a lot from them, not placing a lot of limits. The therapist may recommend that you change your parenting a little bit, that you institute some consequences or other behavioral interventions. There might be some recommendations for the school. If this is a case of bullying or teasing, this is actually a really great time. There's a lot of research, a lot of programs out there. There's a lot of focus on bullying and teasing. We're actually starting to understand the impact of it. Schools, especially as you're kind of in the school age, might do one-on-one mediation. They might do a class-wide program or a school-wide program, an anti-bullying program. There's a lot out there. A lot of them are free. Your school may need some help accessing them if your school counselor or school social worker doesn't know about them. One of my favorites, it's a pretty extensive program, but it's Peter Yeager, I think his name is, from Peter, Paul, and Mary, actually has developed a program with his daughter, an anti-bullying program that's really good and is free, I believe. They also may recommend individual psychotherapy, either for the child, for the parents, family therapy, or maybe even some social skills group therapy. So that's my piece. I think Jenny's going to kind of speak to the family and sibling functioning, and then we'll probably do some questions after that.